Hello, my name is Samantha Batty, NHS Health Check Champion for Leeds GP Confederation. I'm just sharing a short demonstration for SystmOne practices for the completion of risk assessment and risk management for NHS health checks. This is for clinicians that are completing that process within the community. So I'm just demonstrating this on a test patient. Before proceeding to the NHS Health Check template, I am going to check that the patient has received the results back and that those results are within normal range. Anything that's abnormal, of course, at this point, referring to the lipid management summary, then action would need to be taken before proceeding to the health check. So that might be elevated cholesterol, for suspected familial hypercholesterolemia, or any elevated results that require follow-up, whether that be HbA1c, triglycerides. Once checked and happy that they're within normal range, then I'm going to proceed to the NHS Health Check template. The NHS Health Check template, by finding it on here, you will find NHS Health Check Confederation, which is the template used by general practice, and then Leeds NHS Health Check Community Programme, which is for all NHS health checks completed within the community. And selecting the correct template will ensure that you've got all the codes that are required to complete. All of the tabs above here will have been obtained within the information gathering section. So for the clinician responsible for completing the NHS Health Check risk assessment, you're going to go straight to the risk score and recall tab. The SystmOne programme uses QRIS2, so we're going to select QRIS2 calculator, and that will automatically populate the results. This here is a good opportunity to see whether there's any results that may well have been missing or outstanding. So here you can see, of course, it's a test patient, but you can see that the cholesterol is blank, and therefore some blood tests might be still outstanding. Also, the systolic blood pressure is 130, but should it be elevated, you'd want to be making sure that some home blood pressure readings don't remain outstanding before proceeding. If you're happy that everything is accurate, then you can select Save to Record before closing. Not selecting Save to Record will mean that the payment to practice and appropriate follow-up to patients will not be actioned. So you can see on here that there is some options of some information for between 10 and 20 and above 20% risk score that you've calculated. Our dummy patient was under 10%, and therefore I'm going to complete the NHS health check by selecting the primary prevention diagnosis code and both completed tick boxes. So NHS health check completed and NHS health check completed by third party. I'm going to also proceed to select a recall. Now, every practice will use different recalls. This practice uses NHS Health Check 5-year recall, and then it populates a 5-year recall there. The NHS Health Checks formal invitation are populated through the public health searches. However, we encourage a recall still to be added at practice because that can aid the making every contact count process, especially by administrative staff that are frontline, so that they can encourage uptake for patients that remain outstanding. I'm then going to proceed to the patient results and feedback. Select short NHS health check results, and this will populate the results letter for the patient that could be sent out however your practice manages those letters and those communications, whether it be through text message, email, or via letter. Going back to the risk score and recall, if a patient scores between 10 and 20%, this is when you're going to return back to the information that's been gathered as in the Part 1 NHS health check, and you're going to have a look at the modifiable risks and discuss those with the patient. It may well be appropriate also to offer a statin, in which case you're going to select offer statin therapy and then record the outcome of that conversation, either decline contraindicated or initiated. If the patient has provided some informed dissent, we want to know the reason. That will be for information gathering both for public health, but also follow-up conversations on the patient's records with clinicians. If the patient has declined and their Q risk remains between 10 and 20 and they remain eligible for an NHS health check, they will still need a 5-year recall and completion of NHS health check. So the primary prevention here will be selected, NHS health check completed, NHS health check completed by third party, and then exactly the same recall as we found before. If the patient, however, is between 10 and 20% and they do have a statin initiated, then they then fall out of the NHS health check and they should be monitored on an annual basis, however the practice follows that process. At this point, you would select at risk of cardiovascular disease and also the 2 boxes for completion of NHS health check before proceeding to however you manage those patients in practice. If the patient scores over 20% cardiovascular risk, then we're going to always offer a statin and we're going to document the outcome of that conversation here exactly the same way as before. However, regardless if the patient has a statin initiated or declines a statin, they no longer are eligible for an NHS health check, and therefore you're going to select their high risk of cardiovascular disease monitoring. Select both boxes for NHS health check completed, and then select the recall however your practices manages those patients that have been deemed to be high risk of cardiovascular disease. Exactly the same as the patients under 10%, we're going to proceed to complete the NHS health check results. And the short NHS health check results booklet is the one that we're selecting for all patients and sending out. There's a couple of extra tabs here, one for referral and then a little bit of information, admin and guidance. You'll also find some contact details should you have any queries either here or your practice manager will also have our contact details so they can reach out to us directly as well. Just a quick additional note for those patients that are initiating statins, there is, as part of best practice, the majority of patients will have only had a statin, a cholesterol blood test requested, and only those that have had elevated blood pressures or have been deemed to be elevated risk of diabetes will have had a HbA1c. So it's important that the follow-up blood test is managed and arranged for the baseline liver function test, but also to outline any secondary causes for the elevated cholesterol, whether that be diabetes or thyroid. I hope that helps to outline the completion of the NHS health check. Just to summarise, to finalise a health check completed within the community, the Q risk is required to be saved to the records, and both tick boxes of completion, NHS health check completed and NHS health check completed within third party, must be selected in order to capture the information required for appropriate patient follow-up and payment to practice. Thank you.